Good evening, everyone, and a very warm welcome to Keller College. It's great to see so many people here this evening. My name's Juliet Carpenter. I'm Director of Research at the Global Centre on Healthcare and Urbanisation, and we're delighted to welcome you to this, our last public seminar of Michaelmas term. So GCHU brings together interests in sustainable urban development with health and wellbeing. And one of the ways we do that is through holding these public seminars twice a term, and we've been doing that for 6 years now. They're held every 2 months or so in the first and last weeks of the university term. And the format, for those of you who haven't been before, is very informal. We invite 4 speakers from a variety of perspectives to answer a topical question with just a 5-minute response on an issue linked to the research interests that we have in the centre around sustainable urban development and health and wellbeing. And then after that, we hand over to you, the audience, because really what these public seminars are about a dialogue with you and the speakers to really talk about some of these critical societal challenges that we face in this space. So tonight, we're going to be discussing the important issue of social connections in place and whether urban design and community planning can help people stay active, connected and supported where they live. And according to Age UK, in England, over 2 million people aged over 75 are living alone, and approximately 1.4 million older adults experience chronic loneliness. But loneliness, as many of us will know, isn't just an issue for older people. Younger and middle-aged people are also affected. And so tonight's seminar, we're asking the critical question: do neighbourhoods support us to thrive or leave us lonely? And as loneliness is increasingly recognised as an urgent public health issue, what does the growing body of evidence say about creating places that incorporate social connections as a natural part of everyday life? And so I'm delighted to welcome our 4 speakers here today who are going to encourage us to think critically about these important issues. And so I'll just give a brief introduction now. So first up, we're going to have Paul Cann, who has led key voluntary organisations in this space for over 30 years, including Help the Aged and Age UK. He was co-founder of the Campaign to End Loneliness and is currently CEO of Global Initiative on Loneliness and Connection. So welcome, Paul, to the seminar. Next up, we're going to have Dr. Georgina Everett, who's Research and Impact Lead at the national charity Re-Engage, that works to reduce social isolation of older people. So welcome to Georgina as well. Next we have Dr. Hannah Grove, who's a postdoctoral research fellow here at the GCHU, and she has a practice background in planning policy and is also leading the research here at the Centre on Ageing Well in Place. And she's been working with Georgina on the Enola project, which we're going to hear a bit more about shortly. And finally, we have Martin Craddock, who is Chief Executive of United St Saviour's Charity, which supports local communities in the London Borough of Southwark, including the provision of social housing for older people in almshouses. And one of these almshouses, you may have read about, Appleby Blue, has recently won the prestigious RIBA Award, the Royal Institute of British Architects Award, the Sterling Prize, for Britain's best new building, recognising its innovative design features to enhance social connectedness with older people. So welcome, Martin. Looking forward to hearing about that project. So we'll have your 4 short presentations, and then we'll open it up to the floor to you, the audience, for a Q&A session afterwards. So first up, we have Paul. Thanks very much.
Thank you very much. Well, hello everybody. I'm sure you have your favourite spaces or places where you like to be, where you like to go. And my wife and I, we like a place in northern Italy, just a very small town, and it has like a village square where we go after we've had too much to eat in the restaurant locally, and also drink. And it's a wonderful place just to chill out. And we sit in this square plenty of benches, and the older people of the town all come there and gather around and chat and connect. But there's also a playground, and the children come, and late into the night they play around, have fun, and we just love that place. It's a kind of intergenerational sweet spot, if you like. But we don't always have friendly, inclusive squares with a decent climate, do we? And at the campaign to end loneliness, we did some work analysing loneliness and the built environment. And we came to the conclusion that analysing the different factors that contribute to whether people feel cut off or connected. And there are many different factors, from bumping places to benches. And what you need is a coherent approach, like a framework, which does link the micro to the macro. And you need to start with the basics. So here is a slide showing different ways, which are quite small, quite basic, in which you can enable people to come out, to connect, or you can actually disable them. So, as you can see, if there are no buses around, that's a difficult problem to connect. If there isn't any street lighting, you can't actually see where you are walking, and which is often, I think, neglected as an issue. And you also are quite likely to be a bit afraid, a bit apprehensive about the possibility of crime. And we know street lighting has an effect. Decent street lighting has an effect on reducing crime. And benches are an inexpensive way in which people can both rest and they can connect. And there was this buzz phrase, I don't know if you heard it, called social exclusion. A few years ago, it used to be in vogue. It's a great phrase, in my view. And for my mum, living in Banbury, 5 minutes from the shops, in sheltered housing, social exclusion for her meant the fact that there was no bench to rest on the 5-minute walk to the shops. And I think, you know, we do take these things very much for granted, these nitty-gritty things. We know about the quality of pavements is often very variable. Local authorities have to spend a lot of time and money defending actions against them because of the dodgy pavements. And finally, to come to a near obsession of mine, we don't make our toilets as accessible, as available, and as pleasant as they can be. And I connect from time to time with the Helen Hamlin Centre for Inclusive Design, who have done a lot of great work in opening up our minds to the possibility of design. And here there is a report, Designing Inclusive Public Toilets, We the People. My favorite place for toilets, though, is in Japan, where I went earlier this year, and I came across this wonderful sign that is for the male toilets, which combines being very clear about what's happening with the toilet with this kind of aspirational, it happens to be what I think is known as Surf City in Japan. And though the aspirational palm tree and the guy with the surfing board, I think is quite fun. A fundamental aspect of neighbourhoods and how friendly they are is obviously where and how we live. I don't think our offer in this country is anything like as versatile as what is achievable in Europe, where they have different forms of innovative housing. But it is clearly fundamental. There is a range of provision, and it is slowly expanding. And I'm not going to get into each of those because there isn't time, but I'm very attracted to what they call intentional communities. And I visited about a year ago Marmalade Lane, just outside Cambridge, which is where people actually elect to be part of that community, and in return for being part of that community, they have to commit to doing something that contributes to the community. It's won various awards, and it was designed by architects, as you can probably see, to bring people together and not divide them up. So the car parking for Marmalade Lane, which is about 120 people, I think, is pushed to one side. And it's a very inviting, they are very inviting spaces. And I think we absolutely have to recognize the need for us to become more versatile, more imaginative about how we live, because there are precious few Marmalade Lanes and there are relatively few intergenerational opportunities. But above all, we have to recognize the interconnection. And at the Campaign to End Loneliness, we did a report called Promising Approaches to Tackling Loneliness, where we found that there were many different ways of helping people connect, from choirs to pubs to keeping chickens, would you believe? And what mattered actually was the way those different things were connected up, because we are talking about how the physical space of a community is supported by the transport, by the digital access, and simply by the feel of the neighbourhood and how people behave. And that is the diagram from the report Promising Approaches, which tries to set out that interrelationship. So I just want to conclude my 5 minutes by going to a most wonderful writer called Olivia Laing. I don't know if you've come across her work, who I've spent many years, in my sad years, reading about loneliness, and I think she's the most eloquent that I've read. She moved to New York after a relationship breakdown, and as we probably know, New York is a wonderful city, but it's also, like many cities, potentially very alienating and a very lonely place. And there's a whole issue about the isolation of the big city. But what she drew out was a recognition that we are all living in this city, the lonely city, as she put it. And I've come across many different statistics about levels of loneliness in different groups in society, and that's all very good work. But actually, it's a universal, we are all there, and we all need to connect. And so what ultimately matters, as she says, is kindness, solidarity, and it is those messages that are transmitted by the leaders in our communities, in our countries, and the media, which dominate, that actually will make the difference between whether or not we are a kinder community. So that's my starter for 10, and there are the references to the reports that I mentioned. Thank you.
Thanks so much, Paul, for setting the scene like that. Really interesting and useful background. And Georgina, I don't know whether you'd like to come.
Yeah. Thanks. Hi, everybody. As Juliet said, I'm Georgina. I am from Reengage. I will introduce myself very, very briefly and then move on to the actual substance of what I'm here to talk about. But for those of you that don't know, Reengage is a national charity. We work across the UK, working to reduce loneliness and isolation for older people, and we work specifically with people who are aged 75 and above. Obviously, with an aging population, people living longer, that is a growing constituency, and There are different needs within that age group to some of the broader definitions of older people that are used elsewhere. We work with incredible volunteers, around 7,000 volunteers currently, who provide social gatherings and telephone befriending to about 6,000 older people. We get very good feedback on those services. I know that because part of my role is to oversee the evaluation of those services, to find out what difference they're making to people, and also how we can design, deliver, develop services differently to better respond to people's needs. The other part of my role is our research strand. So older people, particularly those who are 75 plus, are often excluded from research, especially if we're talking about research that is of a participatory nature or is closer to something like co-research, then they really tend to be excluded. So we want to do work that deepens our understanding of loneliness and isolation. That could be from things like causes and risk factors to people's experiences and needs, and whether that's about designing good interventions or whether that's about encouraging ways of preventing loneliness happening in the first place. We believe that research should be with rather than done to or about older people. And we want to promote opportunities for older people to participate in relevant and life-enhancing research. If we want to produce those better understandings that I've mentioned and do research that produces insights and recommendations that are life-enhancing for older people, their views and experiences need to be included. So that's kind of the ethos behind us developing more in the way of external research. And we're in a somewhat unique position, given that we are connected to several thousand older people, to access those people, to work with those people, to involve those people in research activities. Sometimes we'll be doing that at scale with large surveys, and sometimes we'll be doing that more qualitatively. So the reason I've ended up here with you today is that we have become increasingly interested in the built environment. There are always discussions about tackling loneliness and isolation, and those increasingly over the last few years have come to focus on more systemic, preventative approaches, thinking about connected communities, so emphasizing the kind of production or encouragement of social connectedness rather than focusing on the loneliness and isolation that comes from not having social connections. So here in the UK and in a number of countries, there are lots of calls for decision-making across all kinds of policy portfolios to take account of the impact that any decisions made will have on social connectedness. And there's obviously, although we're talking about working across policy portfolios, there is an emphasis on infrastructure and environment. And that comes at the same time as there's lots of emphasis on aging in place. So the idea that rather than trying to fund social care in specific residences as people age, that we should be aging well in place. I think it was 2023, I could be wrong, but I think it's 2023, the APPG on loneliness described placemaking as a key tool in the work to prevent loneliness. So hence our interest. But I think for placemaking to function in that way, we do need to do more work. We do need to deepen our understanding and our knowledge of the drivers of connection and disconnection, particularly for those groups whose views have typically, historically, not really been included. We need to examine the barriers and the enablers to community participation, the events or policies or points in the life course where these change or disappear. We need insight into day-to-day life outside of the home and what that feels like for older people. Obviously, that's our interest. We need insights about everybody's lives, but for us, we're interested in what does being out of the home feel like on a day-to-day basis for older people. Obviously, historically, there's been an emphasis on the more objective or tangible features of the built environment, we wanted to get a sense of, okay, well, what are the values attached to those places? What do they mean to older people? And we wanted older people to be able to define accessible on their own terms. What is an accessible neighbourhood to somebody who's 85, 95? We've got lots of things, you know, the 15-minute city, walkable neighbourhoods, those kinds of things. What does any of that look like or mean for older people specifically? So we drafted a proposal for a research project working to explore this with older people and think about when and how environmental changes might impact on their social connectedness. And we wanted to use creative methods to do that. The aim being to gain those insights, to think about how those barriers form or appear or disappear, and how we could remove or mitigate those. So when we were contacted by Hannah asking about working together on this project, we kind of did a little jig because it aligned absolutely with what we wanted to be doing. So we are working at small scale on a pilot project. So we're working with about half a dozen older people in a town on the south coast of England. We decided that we would focus in the first instance on a coastal town. These are popular areas to retire to. So we thought it would be good to start with some insights into what it was like to live there and how people experienced that place. The goal has not changed. We want to understand the role of the built environment. And we're using a range of methods. So informal interviews with participants about their everyday social life, their routines, their experiences, their reflections on those experiences. We are mapping the places that matter to them and using creative collage and things like that to visualize what their ideal social world will look like. So we're not simply gaining insight into how things are and what that means, but also what's an ideal? What does that look like? And we've also been doing go-along interviews, so visiting a place that means something to the participant and talking to them about what that place means to them. So the idea is to be able to capture a better understanding of people's neighbourhoods as they experience them, the stories attached to them, the meaning that they have for people, the feelings that they enable or evoke, capturing those less tangible things. In my experience, I've been at Re-engage for 4 years now, working with older people, particularly above the age of 75, what I'm often hearing is that people feel sidelined, not just socially, but democratically in terms of civic participation. They feel ignored. They feel that they don't have, they're not treated as if they have a stake in their local communities, let alone anything bigger than that. So what we hope is that this sort of research will be an empowering approach to thinking about the role of placemaking in social wellbeing in later life. I don't know that I can provide an answer to the big question that we started this session with, but we're still grappling with this question of also how to ensure that the insights that we might generate or similar projects might generate, how they are valued and incorporated into the evidence base that will be used by decision makers, people who are planning and delivering the places that we live. And perhaps the discussion today will be a step towards that. Thank you very much.
Great, thanks very much, Georgina. That's really interesting context now for Hannah to present some of the more detailed fieldwork of the Enola project, where they've been collaborating together.
So good evening, everybody. So yeah, following on from Georgina's talk this afternoon, I'm going to now give a little window into some of the results, and I'm going to talk about one of our participants in particular, Martha. That's not her real name, but it's the name we're using for this research. and I'm going to show you what some of the results from the fieldwork that I've been doing over the past few months. I'm going to show you what her social world looks like, and also an ideal social outing that she described to me, and I'm going to talk you through the challenges and the sort of realities of that experience. So this is Martha's social world. There's a few different things. So we sat together in her living room, and over a couple of hours and plenty of tea and coffee, we built this social world. And these are the things that matter most to her. In the centre of her life is her son, who's now in his 70s, she's in her 90s. And really, if he's okay, she's okay. Other things that she mentioned were the place that her and her husband got married in the neighbouring town, which she very place of importance to her. The community centres, some of which she still attends, but others have closed and that she can no longer make. She talked a lot about her neighbours offering support, such as going to the shops or assisting a friend assisting her when she gets off a bus stop. She mentioned the tea parties that she attends as part of Re-engage, and the importance of going to the town centre, sitting at a bench and chatting with strangers, and how it was a very sociable space for her, and the sort of journey to and from using the bus as part of that. Some of this was sort of an ideal social environment. Others were more, some were things that she still does, but others were sort of more things she would like to do. And so as part of our conversations for what her ideal social outing, a sort of an ideal social world would look like, she described a social outing that she would like to undertake, but she's currently unable to do. And I've sort of visualised it here for you now. So what she would really like to do most is to leave her house, to get on a bus, go into town, go to a clothing shop and buy some new clothes, because she's lost a little bit of weight and would like some new clothes. She thought, once she's there, maybe she can go for a coffee just nearby, and then get home on the bus. And as she was talking about it, I've highlighted in bold, sort of the conversation with herself as she's saying it out loud, that she can't do it currently, but she's thinking about, maybe if I can get out of the house, then I can go down the steps, and sort of trying to figure out how this journey could be planned, and the sort of amount of negotiation and consideration she has to think about for this journey. I'm now going to break this journey up into each part and show you some of the challenges associated with each of the parts of it. So let's start with the first one. So Martha, she's age 93, and she has very reduced mobility and uses this walker. This is her front door. She can't leave the house unless somebody helps her out with the step outside her house, because it's not wide enough to fit the walker on. You can see how narrow the path, the slab is. It needs to be double the length, otherwise there's a risk that it would fall and she would hurt herself, and she also has to lift it over the threshold. So she relies on neighbourly support or friend to be able to leave the house in the first instance. Her nearest bus stop is reasonably close by on a map. Objectively, it looks like an accessible environment. It's 80 metres from her house. A lot of people would be very happy with that kind of having a bus stop so close to her house. But for somebody with very limited mobility, that's a huge challenge. And getting on the bus, it would take approximately 15 minutes to travel by bus to the centre of town. And this is the town centre. When she described how she used to attend a local community centre by bus, but a friend of hers used to wait for her at the bus stop to accompany her to the community centre. So she would envisage that she would need that kind of support to do that outing, the one she imagined. And let's say she went to the clothes shop. The one she mentioned is approximately 100 metres to get from the bus stop. And she mentioned she might like to pop to a coffee, and there was a coffee shop 50 metres or so away from the shop. So that's, in general, an ideal social outing that she's identified. And one thing that she mentioned that really resonates is, if you're going to walk out on your Zimmer, she calls it, but walker, you've got to remember that you've not only got to do the journey there, but you've got to also get back and make sure you've got enough energy to do that. So on the way back, that friend would always accompany her if she was doing the community centre outing, and so that would also be needed. But one thing that happened when she was attending the community centre, this was several years ago, the bus stop that was outside her community centre changed and became a drop-off only bus stop. And the way that she found that out was via a notice board, a notice on a lamppost. So here's a quote that just sort of summarises this. She describes how it used to be really handy for her. She could get off and she had her plan and her routine. And it wasn't just her that was affected by this. You know, it's an opposite a community centre specifically for older people. And overnight, the 300 metres they have to walk to get to the next bus stop meant that a lot of people were no longer able to make that journey. And she describes how some of the health challenges she's had makes it really difficult for her to walk that far. So the bus is a big issue, but you know, if she was able to find a way to get on the bus, the return bus stop is again 60 metres from her house, but the problem remains that she still can't get back into the house without the help with the getting back into the step. So I really just wanted to illustrate an everyday reality or an experience of what it's like for somebody that's trying to achieve their social life but is finding it difficult. And by understanding the lived experiences of older people and the sort of the everyday realities of their routines, we can really get an insight into, you can really see how an age-friendly environment is not an objective one-size-fits-all thing, that even on paper it might look like a more accessible environment. There can still be various challenges with getting on the bus and these micro detail elements that Paul mentioned earlier on that we need to consider. So we'll leave it there for now because of time, but thank you very much.
Thanks so much, Hannah. Really interesting insights into those lived experiences. Martin, do you want to?
Thank you very much. Great honour to come to Oxford to talk here, and I hopefully bring a solution to these challenges which face society in general. And the way I'm going to do that is talk about this rather lovely building that you see here on the right called Appleby Blue Almshouse, which we think is a solution and a model of how we can connect older people, particularly in social housing, back into society, into the communities, keep them there, and make their lives joyful. I'll just tell you a little bit about United St Saviour's. So we're a charity based in the London Borough of Southwark. We were founded in 1541, and we've actually been providing housing since 1588. And we provide it to older people in the London Borough of Southwark. You can see the bottom left-hand photo is one of our other almshouses, quite iconic Hopton's almshouses. It's just behind the Tate Modern, surrounded by high-rise skyscrapers, but filled with an amazing community of 20 older people who get on with each other, give each other mutual support, and we look after the buildings, and we provide sort of wrap-around support to help them live a better, independent life. That pub in the middle is our pub. We own 4 pubs in Southwark. That's in Borough Market, one of the busiest pubs in London, and we own sort of shops and flats, and that's ancient endowed land, and that funds us as a charity. We do charge rent, or the equivalent of rent, for our residents, but we also, with the income from that, we provide grants to other charities in Southwark, tackling a whole range of social issues. It could be knife crime projects, it could be refugee projects, a whole variety of things. We spend 1.2 million. We also provide a programme for young people within the borough, helping them reach their potential. We're also very much into being a learning, research, knowledge sharing organisation, and even though we're very small, we're quite mighty. And what we do is we come to places like this, or people come to us, and they enjoy being influenced by our practice, and we're also building on our successes and building new almshouses. So we're not going to stop just at Appleby Blue. That's on the stage at the Sterling Prize. I can't not mention that. Our development costs about 25 million. So for social housing, it's 57 homes housing 65 people, range between 65 years and 96 years of age. It was funded through a private developer who was building 3 tower blocks of mixture of residential and offices, and their obligation to provide affordable housing, they didn't build it on site. The local authority allowed us to build it off site as long as it was built to exceptional design quality and to our own architect's specification. The architect we chose were called Witherford Watson Mann. They'd never done anything like it before. They saw the challenge that older people, particularly in urban centres, if you live in social housing, you often live in sort of 3-bed under-occupied council homes or flats, and there was nothing for you to move on to, and often you'd live in those homes for many, many years and probably leave it to your late 80s when you suddenly hit a housing crisis or a medical crisis where you then you feel you're forced to actually move. And the choices on offer for older people are not exactly aspirational. They are often nondescript homes. They don't feel part of the community. There's very few staff in them. The community, there's no real sense of community, or people are pushed to the margins of the city or down to the coast. And for some people that's fine, but for those older people who still want to be active and feel part of the community and demonstrate they really do have a value still to society, nothing really on offer until now. So our architect has built in, they've created a building that engineers in social connectivity right into its design. There's a community centre at the heart of it. Now, most sheltered living spaces will have a resident lounge and the furniture in there is very lovely, but it's also very underused. We said we don't want that. We want a community centre, the whole community to come into it. And we have a team of community centre experts on site, which we fund, and they animate the space using young people who come in, and we can have mums and toddler clubs. We can have cooking sessions in the cookery school, and just brings young people together with older people. Now, sometimes they join in, sometimes they just want to listen to the sound of people having fun who aren't their neighbours, and it just gives them that joy and improves their health and well-being. And you can see on the right-hand side there, we don't have balconies in our building. Balconies isolate people. They make people feel lonely. This is what residents told our architect. So we thought we're going to make walkways, which design and have benches there for people to sit and meet and have a cup of tea with their neighbours outside. And they are so successful. It's become a real sort of feature of this thing. There's a film. It's going to take 50 seconds, which is done by RIBA. I think it starts now. Sociability is built right into the heart of this building. People can engage with each other at varying degrees. They can meet people from outside, or they can meet their fellow neighbours.
We start looking through the windows, see neighbours, or you look over there, we can wave to them, and it's nice.
And it's good for, meeting people down there. It's just a lovely little gathering sometimes.
I get to sit there and peep at my neighbours. So I enjoy that.
It's a social housing project, an almshouse for older people, but through the quality of the way it's made, through the gardens, through the openness to other organisations and people being able to interact with others, is a very strong model for the future.
It doesn't look like social housing, but everybody, I think 85% of the people who live in there receive full housing benefit. So they come from very sort of limited income, marginalised lives, and what they've done is they've moved out of sort of 3-bedroom homes. They've taken that risk because they thought, this is somewhere I really want to live, and it's created movement in the housing chain, and we think we've freed up over 100 bedrooms as a result of it. And we've had people from all over the world now come and sort of see this is the model for being part of solving the nation's housing crisis. There's a few pictures here of what goes on there. As I said, we really are learning from it. We've got connections with academic research funders, and we've been doing some research projects already with Bournemouth University, King's College. Was it King's or UCL? I can't remember. And they're doing health and well-being studies just to sort of have that robust evidence base, so that when we go out and tell people this is making a difference, we can say we've got the numbers to prove it, or we've got the pictures and words to prove it. And we actually do measure the impacts on our residents. We use a methodology called Outcome Star, where we measure people's trajectory in life on 7 key areas, and you can sort of see how people's lives change as they get older. Things happen to them, and we have a team there who sit alongside the community centre staff, who are like pastoral care workers, and we will put in place interventions where we can engage other people in the community to come in and support them. Or we've set up a men's club, for example, when a lot of men who don't engage naturally in communities, in social housing, we said what we can do is we'll set up a men's club for you, and they now do cooking classes, and they've all become good friends with each other. There's a couple of projects there. My PR person thinks I now need my own LinkedIn QR code, so she thinks my ego's got the better of me. But there's a lovely report there which you can scan, and it's a bit research based. But thank you very much for listening. Looking forward to your questions and answers.
That's great. Thanks very much, Martin, for that example, sharing that. Thanks to all the 4 speakers. Now over to the audience, over to you. If anyone has any questions, do raise your hand. And if you could possibly say your name and any affiliation you have, that would be great. So we have a roving mic just there. So any questions? Yeah, just here in the blue, just on the right there.
Hi there, thank you. I really enjoyed listening to you all, and it's very interesting and inspiring. And I'm really sort of agree with what a lot of you talked about, which was about this the extra, the catalyst, the sort of connector. And I was just sort of, it's not really a question, I'm trying to turn it into a question, but I can't, but hopefully you'll be able to say something about it. But I was just struck by some sheltered housing in Oxford, which was sort of spanking new about 10 years ago and built with a beautiful communal area. And, and guess what? The communal area was empty day on day on day on day. We've all seen this, haven't we? And then by contrast, a sort of centre of town venue, which is virtually impossible for anybody to get into, and the loos are upstairs, and it's, it's slippery and all the rest of it. And it's a sort of, well, it's changed a little bit now, but it's an absolutely thriving place where people chose to go to again and again. So I suppose I just wanted, it's just interesting thinking of those things, and just again just how important it is to have people who lead and bring people together, and then they can things kind of take off on their own, and what can be done to the sheltered housing, which billions of pounds have been spent on. Obviously not the same with you, Martin, but in so many places where there's something going on, isn't there, that people that don't feel, they feel more lonely often when they move there than where they'd been previously. So just some thoughts, really. Thanks.
Anyone would like to respond?
I think you've nailed it in the fact that you can build beautiful buildings, but I keep saying to my architect, you've done us a lovely building, but it's enabled us to do the hard work. And the hard work really is that community building. The way that we chose our residents, we had to cut off the waiting list when it got to 100. And we were saying to people, when you want to move here, do you understand it's going to be a different model than you typically think? Are you ready for it? And some people said, I want that quiet retreat away from society. I don't want the high street sort of feeling that people are looking in on us. But most people have really embraced that. But to have that staff team there doing it is the key to it. Now, we're quite blessed is that we've got sort of the money that we can invest in doing it. But of course, local authorities and housing associations won't do it. They've got very tight margins. And it's a shame, because the benefit, this social return on investment as such, where we can already see that we've got residents who go to their GP fewer times now. The people have stopped going to the Maudsley Hospital as a result of living there. that cost saving is enormous. But you try getting a politician to say, let's fund community centre teams to go in there, because the benefits, I mean, our benefits will accrue for decades and centuries, because it costs 25 million. It probably costs 25% more to build our site. But the difference it will make to society is just going to go on forever and ever. So.
Okay. One of the many things I liked about Martin's presentation is the word joyful. I just think that's such an important thing to hold in public policy. We have very solemn discussions about policies, but actually the value of joyfulness is huge. And the other thing I want to say, building on what Georgina was talking about, is that it doesn't actually take very much money to do some basic enabling things. But if you ask people what they want, they will point out to you, like Martha did, about how inconvenient it is to make certain bits of the journey, and how it is possible, with a little bit of imagination, with the older people or the users driving what happens, you can make a big difference. But my final point was, I don't know if any of you have come across the idea of age-friendly cities and communities, as in the first of those, and probably still the leading one, is Manchester. Manchester is very proud. It calls itself a great place to grow older, and which I think is wonderful. But my kind of challenge here, having watched one of your videos about a previous presentation from Banbury, is why isn't Oxford an age-friendly city? Why is it not gripping that incredible opportunity? So that's just a challenge. I was just wondering about that.
I'll be very brief. Yeah, it's a really interesting question, and I think something that strikes me listening to Martin is there's an awful lot of hard work going into what's happening in that development. But I suspect the hard work aspect of it is not visible to the residents. It feels natural that all of that stuff is happening there. And I think that's really important. Something that we often find when we talk to older people is they really don't like sometimes to have to ask for help. They have enjoyed long years of independence, and it's not nice to reach a point where you do feel dependent on others. You feel like people are giving a service. You want things to be happening naturally. And so if there isn't life in that communal space in the centre of a sheltered housing development, if things aren't happening there in the way that it sounds like Martin's team are ensuring is happening, then it's an artificial space. It doesn't have a real purpose. And I think the more that something can feel like it's happening anyway, it's not being put on especially because all these poor old people haven't got anything to do. You know, I think that can feel much nicer. It's an inherent invitation that comes from the place and its nature and its use, rather than here's a space for you to go and all sit together. I don't know if I'm articulating that very well, but it needs to feel natural. It needs to feel that it would just happen because that's the kind of space that it is.
Yeah, there's a question at the back there.
Hi, I'm really curious to hear whether any of you are working with local councils to kind of push this age concern agenda and making sure that they are taking these concerns into policy, that they are actively thinking about these issues, because it seems to me that between you all have a huge amount of expertise in terms of evidence, you know, from talking about, Paul was talking about, you know, simply putting benches around, but knowing it and influencing local policymakers. How does that happen, and is that happening?
Yes, in the London Borough of Southwark, they're incredibly progressive about this. I mean, they're an age-friendly borough. I mean, I don't know what that really means. They haven't put a lot of investment into that. But when it comes to providing decent housing, they really understand it now. So a lot of local authorities really don't consider allocating sites for older people's housing of decent quality. Southwark have said that, and we work very, very closely with them. There's a really good consortium of older people's providers, service providers as well, in the borough, and they get supported by the council. Now, those organisations would say there isn't enough money for them, probably is right, but I think we're very lucky. But I know we are lucky because I don't think it's happening elsewhere necessarily, and this is why we're going around the country, and this is why we're going around the world, and we have people come to us. And I think we're hopefully starting to open up some minds now from the local authorities. They need to be doing this. It does bring benefits.
In terms of the age-friendly cities and framework, it's a global network. So there are some cities that are doing it, like you mentioned Manchester already, or towns. Banbury is our nearest age-friendly town. So yeah, it really depends on, you'd need someone in the local government to be sort of a champion and really pushing that. So, and it's not always easy with budget constraints and things to sort of be a leader in that space. But the Centre for Ageing Better is the sort of coordinator for that at a national level in England. And yeah, you can see how many cities there are. And in terms of the Oxford example, there's a project that I'm going to be starting in January working with the Healthy and Ageing Care Network in Oxford Brookes, where we're trying to lay some of the groundwork for an age-friendly Oxford, and so that preliminary evidence that might help feed into that. So yeah, watch this space for that, for the Oxford example.
Always going to hold you to that.
Oh yeah, we've got a question right at the back, and then we've got two in the front here.
Hiya, thanks, that was really interesting. I was wondering about how this idea of like the end user being perhaps the people over 75, and I just wanted to talk a little bit about younger age groups who are caring for those people. So, you know, I certainly have experienced this in my family, my mum looking after my grandma. It's often like middle-aged or slightly older women that the burden falls on, not only women, but that is, in my experience, a big group that ends up taking that burden because of the kind of creaking state of the social care system. And I think that group as well could be considered an end user, right? Like they're the ones going to the pharmacy who have to like rush between their work and the pharmacy and the care home and the whatever. And I just wondered in terms of, you know, end users of these systems, whether or not in your work you kind of think about some of those people around the older generations, because yeah, I think even though those carers are providing kind of emotional support and a support against loneliness to young people, it can be very lonely for them as well. And the more pressure that's on them, the less support that they can provide. So I just wondered if that had kind of come up in your work and what you thought about that.
So I'm always the first to grab the mic here. I got a lovely example actually of exactly that. There was one resident moved in and her daughter was her primary carer, and she was very anxious about her mum moving in, and her whole life had been essentially controlled by her mum's problems. And when her mother moved in, we had a lot, you know, the relationship was quite tough with that daughter for a while, and she'd never been on holiday for years, never really, because she's always worried about what her mother would be up to. Now she's actually complained to us saying, I never get to see my mum because she's too busy with you. Now that's sort of, we didn't think, that's not intentional. We didn't actually realise that. And it's a lovely example there. I mean, there's another one, there's a young adult with autism who visits the grandmother, and because of we didn't realise actually what we've built is a building for the whole community. And it's not just the community spaces, but we've created those sort of spaces where that young man with autism can now just lie in those corridors on the lovely cold tiles and say, this is my safe space. Because we've created a space that doesn't feel institutional or stigmatizing. They can do that. And you know, We have grandchildren. I mean, I've got a mother-in-law who's in a residential care home. They're not the nicest places to go and visit. I mean, it's a nice one, but you have the smells, and they feel you've got notice boards everywhere. Do this, do that. If you've created a space which it's actually nice to go and see Grandad, it brings the community in, and so this type of a building just feels non-institutional, and I think that's what we've created, and we didn't think of it. We're very lucky we've got it. Who wants to go next?
Right. Oops. Sorry, the younger carer thing is a huge agenda, and indeed the issue of caring, what I call the loneliness of the long-distance carer, is very common, and it's all part of our nuancing the agenda around loneliness, so we do understand loneliness is not just a thing which older people get. But I think, we've got the opportunity here to focus in on what we call intergenerational links, and we do have a wonderful thing called home share, which at a lower level of intensity to formal caring is connecting younger and older people. And I know that Marion is here who can talk about that, but I wish things like home share, bringing younger and older, could really flourish.
Thanks. It's a really important question, and it's something we're very conscious of in terms of service delivery, because we have, on the one hand, we might have older people who connect to our services because they've moved into an annex, say, with a family member, because that was felt like the best thing to do as their care needs increase. But actually, what they've left behind is their social network, and now they live in a house where everybody goes out to work and school during the day, and actually they feel less connected. So people might find their way to us that way. We also know that for some family members, if they suggest to an older person that they join one of our services, that afternoon when they're at a tea party, say, or an activity group, that's a few hours of a day, especially if they don't live super close to their family. That's a few hours where they know that person is taken care of and they don't have to worry about them. So we are very conscious of those family relationships. And I know a lot of older people with the tea parties, particularly if the volunteers bring their kids along or even just talk about their kids, they love that. So yeah, the intergenerational aspect on a service delivery side, absolutely. But yeah, I've been working a lot with some national statistics around loneliness risk factors, and being an unpaid carer is a huge exposure to risk for loneliness, and perhaps not social isolation. Maybe sometimes you'd like to be a bit more isolated than you are, but yeah, it can be a lonely thing, and we're very conscious that is there. We can't answer everything with our services, but certainly with this kind of research, I think the more that I'm not from an environmental or urbanisation research background, but the more that I learn in this space, the more conscious I am that inclusive design benefits every single person. The design might be with specific needs and specific groups in mind, but every single person in that community benefits from everyone having access to that space. So yeah, it's definitely something we're thinking about.
So there are questions, yeah.
I used to work for a local charity which encouraged all sorts of book groups and experiences around books, and one of them was to take book groups into settings where the elderly could meet with something in common with a facilitator. Our very last project, just before COVID, which of course tells you why it isn't happening now, was to do an intergenerational version. And that was extraordinary because it was very difficult to set up, to find schools with nursery age children who were prepared to take them to the older people that we thought would be the intergenerational. But we did, and we found it locally here. There was a nursery school which brought people in every week with a wonderful facilitator, and it was not, you've come to meet the old people. It was the old people are going to be helping you with reading, singing, telling stories, and it was extraordinary. It only lasted for about 2 terms before it was stopped. There's a very good television program about an experiment like that in Bristol, and I just thought that the naturalness and the it's not patronising one side or the other. Each is getting something out of it, and again, it was filling one of these beautifully appointed old folks' homes, community rooms, which was actually essentially, when you arrived and there was nobody there, it was a depressing place with, you know, all the heavy armchairs couldn't be moved, and eventually it was in a circle, and the kids were moving around, and it was different, and that was just something which I think you in Southwark have got the opportunity for, because it's a community space, not an old folks' ghetto to which people are sometimes brought.
Sorry, yeah, just to comment on that, I think, so we did get a lot of requests from organisations, groups who would say, oh, do you want us to come and teach older people to do this thing or that thing? And we stopped taking those questions to older people in the end, because almost every time they would turn around and say, look, we've got things we could teach people. We've all got huge amounts of experience and expertise from various different fields, and why are we constantly being offered learning when we could be delivering these things? So yeah, I agree. It's as much as possible, it's great for it to be mutual, and for people's value to be recognised, whatever shape that value takes. So yeah, I love the sound of that book group.
There's a real problem in a lot of organisations where I think they incorrectly sort of sense that a project has failed because very few people have turned up. So we have a mums and toddlers group, a parents and toddlers group, being a father, and but of the 65 people who live in Appleby Blue, there's about 2 or 3 of the residents actually get involved in it. And now, you're right. If it was just that the place in Bristol, St Monica's Trust, I mean, they had quite a different cohort of residents there compared to what we've got. But if you see a project has failed because only 3 people have turned up and you give up on it, then it becomes then you've ruined the lives of 3 people really. And I think and so we've created something which I think you've nailed. Then I'm really sort of going to reflect on this, is that because we're not a ghetto for older people, because we're bringing in all these other organisations, if the residents want to engage and they can engage. If nobody engages from residents, it doesn't matter. There's still something going on, and they can hear it. But that's what's nice. It's not. It's really important. Thank you for that. I'm going to take that one away with me.
One more question. Oh, yeah. 2. Yeah, we're running out of time, but yeah, quick question there, and a quick question in the front, and then yeah.
I was just really appreciated hearing about that methodology that you did with that older person to understand their context and their ideal social outing. I was just thinking about, in particular, for example, that challenge around the drop-off bus stop, and sort of, on one hand being able to appreciate, that really was, quite a significant barrier. In fact, 3 times the distance with the walking, and then sort of trying to think on the other hand, was that done maybe to improve, efficiency of the buses through the city centre, which, makes sort of journeys shorter and encourages people to use it, and, that might have been going after sort of climate objectives or something like that. So I guess I was just sort of wondering, how do you kind of reconcile those sort of policy tensions?
Yeah, I'm still looking into the bus routes of that town, and the data is still underway. So I know there has been a lot of tensions in communities around losses of bus services in some areas, and other buses happening elsewhere. And then even the things, they're not all operated by the same people, and it's that can be an issue as well. And how the service delivery is provided at that sort of strategic level to make sure that people are not losing out, and if the routes changed, how that's communicated. But then also the provision of things like the dial-a-bus sort of service where you can get maybe a bespoke, someone more than a taxi, a little bit more support than a taxi, but maybe that could fill in some gaps as well. So yeah, I'll have a bit more of a sense once I've finished all the field work of that more strategic policy element that I'll be able to reflect and say more about. But yeah, hope that helps for now.
Yeah, one last question.
I'll keep it quick. Georgina, to your point of like recognizing and utilizing the wisdom and knowledge and expertise that's in a lot of these communities for older persons, I'm curious if any of your research or projects have an element of empowering older persons to actually advocate on the policy level for themselves instead of just it being a room talking about older persons and there's not actually like older people just advocating.
Yeah, thank you. Yeah, so we have a research group that we put together. It was probably about this time last year, maybe a little bit earlier in the year, which is made up of a number of older people who are involved in our services, some of the volunteers who are involved in our services, and if people come to us, so we have a research accelerator program. If somebody's doing research and they think that we could support the development or the recruitment or anything like that on that research, they can come to us, and those applications we take to, we try to meet every 4 to 6 weeks. We don't meet if there's nothing to talk about, but yeah, so we meet with that group and they have the agency to talk about and decide, is this the kind of research that we want Reengage to put its time and resources to? You know, that decision is in their hands. We've spent the last, where are we now? December, the last 8 months with that group developing a research project, which is their research project. So we've kind of given them the scaffolding, the structure to think about what do they want to research into and why and how should we go about that. And it's just been a real pleasure. We've got to the point now where not only do they know what they're interested in, but from their suggestion, my colleagues who look at policy are working around this subject as well. And the research group now will be, their research activities will support the work of the policy and campaign team on this topic. And so that hopefully will give us a kind of blueprint for enabling, that's a terrible word, enabling the research group to do those things and have that function within the charity. So we won't partner on research that doesn't have older people at least as participants. Our initial goal was we wanted everything to be co-produced, but it's to go from nothing to complete and full co-production is a big leap. So we're having to take baby steps there, but our goal is that everything we do in-house will be co-produced as far as our group is comfortable with, and we'll continue to recruit that group, and we continue to share opportunities to participate in external research as well. So if there's anybody here who's working on a project and you're looking for participants over 75, let us know and we can help put the word out. And I'm not promising you're going to be bombarded with applications from people, but yeah, we're really wanting to connect older people to research as far as they want to and let them be involved however they want to be.
And there's a general point here, that about the position of older people in making policy and making decisions. So quite a long time ago now, there was a thing called Better Government for Older People, which was very, very good on this principle of nothing about us without us. And so very often older people formed panels which made the running on the decisions, for example, in some of the boroughs about transport. But I think this is a general point about where do we place the people for whom it most matters in the scheme of things. Do we place them out there as recipients, or do we put them centre stage as owners and shapers of policy?
That's great. I think that's a great moment to wrap up and a great message to end on. So thanks to you, the audience, for such great questions. Just to say that we are recording this session and we record all our seminars. You'll find them on our website in our back catalogue. So if you have friends and colleagues who might be interested in listening to this or any of the other seminars, do take a look at our website there. And just a plug for the next seminar, which is in January week 1, so that's Wednesday the 21st of January, same time, same place. And January seminar is going to be looking at community-led planning, in particular around deliberative democratic processes, how community-led planning and community engagement in planning can make cities more adaptive and healthier. So do join us if you're free. We'd love to see you there. And in the meantime, I'd just like to thank the 4 speakers very much, to Paul, Martin, Hannah and Georgina, for a great seminar and really interesting presentations. Thanks so much.